I'm here to teach you how to flush your Hickman catheter. We flush a catheter once a day, every day, at the same time to prevent any kind of blood formation and to keep the vein and to keep the lumen open. Heparin is a medication that you use to flush your line to prevent any kind of blood clotting. Before we start, we have to make sure that we wash our hands. So wash your hands with soap and water. Dry with a paper towel. This is very important because the first line of defense is cleanliness. Now we need to clean our table with paper towel. We already have our equipment ready here. So you have your 2 lumens with 2 heparin pre-filled syringes and 2 packets of alcohol. With your clean towel, lay it open. Make sure you drape it close to your body. Before you start, you wash your hands again. This is your pre-filled heparin syringes and your alcohol pads. Make sure that when you open your heparin flushes, you remove some of the air out from the syringe, expelling all the air out. And once it's out, recap the syringe, making sure you do not touch the tip of the syringe. Now we can proceed with scrubbing the tip of the lumen. So you put it in the center of the alcohol pad, scrub it vigorously for about 15 seconds. At this point, you want to make sure that you have your heparin syringe ready and slowly screw it to the end of the cap. Open your line and slowly push it in, making sure that your thumb is not meeting any kind of resistance. At this point, you make sure that if you meet any kind of resistance, you stop and clamp your lumen and call your doctor. But if you don't have any problem, make sure that you're pushing all the heparin in, leaving a little bit in the syringe, and clamp the line. If you have any kind of resistance while you're flushing the line, you stop and call your doctor. If you have any chills, or if you notice that there's any kind of breaks or leakage on your lumen, you make sure that you call your healthcare provider. To prevent any kind of infection, you make sure that you have a clean hands when you work on your flushing. I have a patient guide here for you that you can refer to. I also have a brochure that you can look at and follow to make sure that you are following the procedure correctly. A video of your choice. If you have any problems, you have to refer to it. You are most certainly have to call your doctor or your nurse if you have any kinds of question. And the most common things that patients ask if they have any kind of chills while they're flushing the line, you have to stop because this can be a sign of infection. If you drop any of the syringes on the floor, you make sure that you get another syringe and you clean your cap. And that's how these are the things that you can prevent yourself from any kind of introducing any kind of infection to your line. Any kind of question that you might need, even if it's something simple, it is something that you need to address to your doctor or to your nurse. Any kind of concern, this is something that you need to call your doctor, or something that you are not aware, something that you have a question, and something so simple, because this can prevent you from any kind of problem. So if you have any questions or concern, give us a call and we are here for you. Thank you.